Okay, our next presenter tonight has distinguished herself in New York State by speaking out on the health assessments that are from the perspective of the whole medical community in New York State, as exemplified by the New York State Medical Society and many local medical societies, the call for a comprehensive health impact assessment in New York State around these very issues that you've heard tonight, around the inability for us to gain access to the chemical nature of what's going down in these well bores, and also what's coming out, even more so as to what you do with it. Her name is Larissa Dreska, close enough? And she's a graduate of, and I think, I'm not going to go through her entire bio here. You've received that and can refer to it in the middle of the program. She's a tremendous advocate for public health. She's testified before the New York State Assembly on health, and has also testified before the New York State Democratic Caucus, as well as testifying in Washington on health assessment needs in the nation. So I'd like to introduce to you Larissa Dreska.
Thank you for the testimony that you've delivered. I think this really is the first time that we've heard from the workers and people who are so directly impacted in one place. So I hope to do some justice today to describing some of the health impacts. So I think most of you are familiar with the process of gas drilling, conventional versus unconventional wells. What we're talking about here is the unconventional process, which means using tons more water, chemicals, and silica sand. Impacts are also going to be tons of times greater. So it's the magnitude of the process. And also what we're talking about is from the process from cradle to grave. That means extracting the silica sand, bringing it to the location where the gas drilling is going to be done, transporting the water, transporting the chemicals, transporting the C4 as we heard, transporting the equipment and locating it, padding it, then drilling the well. Afterwards, there's a potential for, or during any of those processes, there's a potential for the accidents and also for spills. Following that, there's the disposal of waste that we have to worry about that might potentially impact us, and also the transport of the ultimate product and the consumption of that ultimate product. So problems can occur at any of those points, but what I'd like to do is mainly talk about who can be impacted. And these slides are a progression of in Bradford County, the wells that have been drilled since 2008, and it's just to give you an idea of what the well development is in Bradford County, Pennsylvania. So up to October of 2012. In order to develop this many wells, you need to also put infrastructure in place. And this is a picture of the infrastructure that's been put into place that includes the water impoundments, water withdrawals, compressor stations, processing plants, pipelines, vertical and horizontal wells. And what they don't show you are the places where water has been contaminated. This is just an unofficial survey that was done by my colleagues at Damascus Citizens. They walked along Route 514 in the south central part of Bradford County, and they found that there were, this was September 2011, 92 wells that had been impacted, where people had water buffaloes, where they had chemicals that had been found in their blood or in their water or methane. So who are the people who might be impacted? I mentioned the places where these problems can occur, but who are the people who could be impacted? Well, that includes people in the areas where the silica sand is being mined, and that's Wyoming for the most part, and Minnesota. The silica sand has to be transported, usually via rail car, brought to the location. We've seen silica sand being offloaded behind daycare centers. The trains will stop at the depot right behind a daycare center, offload. Impacts are now being looked at by National Institute for Occupational Safety and Health, the impacts on the workers, but the residents and the children who are going to be breathing this polluted air from the silica are not being looked at. People who are downwind, people who use the water, people who use the gas, and of course the workers, as we've started to hear about. These are the determinants of health, what cause a person to be healthy or to be susceptible to illness. And so we know that our DNA and our age and in general, our lifestyle, we know that these are things that impact how we come out and how we eventually live, how healthy we are. But what science has found is the two most important determinants of health are the social and community impacts and also the environmental impacts. So those are the two that I'm going to be speaking about, and as it turns out, those are the two determinants of health that are most impacted by the gas drilling. So what are some of the community stressors? Well, there are stressors that have been observed about concerning road safety and workers, and I have a separate slide just about the workers, because that's really a very significant problem that has not been really identified and spoken about in the past. Housing has become unaffordable, as you mentioned, Mac, and that has been documented in literature. So landlords know that they can get a greater amount of money from the workers, so they will displace the families that have lived in these homes for a long time. This displacement causes a unraveling of the social network of a community. So displaced people from housing that has become unaffordable, from homes where the water has become contaminated. So it also causes a rift, as you know, as many of the people from Pennsylvania here can attest, causes a rift within the community. Those who say my water is fine and I've made some money, but they don't really mention that part of it, my water's fine, and those whose water has been polluted. So those homes are unmarketable. People totally lose the economic benefit from it, and that is also a major problem. Environmental and social justice concerns, such as vulnerable populations, those are supposed to be addressed according to directives by executive order. So children need to be protected from environmental risk, and so should low-income populations and minority populations. But gas drilling often occurs in rural, underserved, and poorer population, near these vulnerable populations. So also people who are already under stress because they're poor or because they're underserved are at greater risk and will have a greater impact to their health if they're exposed to environmental toxins. That has been documented, that stress of an underlying either illness or socioeconomic status, if they're stressed in addition with an environmental stressor, they will react worse to that than someone who is otherwise healthy. So this is the OSHA information for workers in the gas industry. We know that truck traffic is a cornerstone of this industrialization. Hundreds of truck trips a day. Actually, per frac, it's 1,600 one-way truck trips. CDC, Centers for Disease Control, tell us that transportation accidents are the leading cause of occupational fatality in the mining industry. And we know for a fact that from data from National Institute for Occupational Safety and Health, that the gas and oil industry has 8 times the premature on-the-job mortality rate than at the average job in the United States. So, and the actual data is this. Between 2003 and 2008, 648 oil and gas workers were fatally injured, and that's how they came up with the fatality rate, knowing how many oil and gas workers there were. So half of them, the reason for the deaths were highway crashes, and also workers struck by objects and equipment. So this will also have an impact on the community. Workers will come and live in the community, and they're going to bring whatever assets or whatever woes come with them to the community. It will impact the community character and the resources. So we also know that unhealthy behaviors such as drug abuse and crime often accompany the influx of new workers, which also affects the lifestyle of the community. So the silica sand is what is used currently in the fracturing process, which comes from the Midwest. It causes silicosis, which is a preventable disease, but it's incurable once you get it. So it's considered an occupational lung carcinogen, and there's evidence that inhaling it can cause chronic obstructive pulmonary disease that can also be later be complicated by tuberculosis or other infectious diseases. Also, these workers will bring their clothes home or to the laundry, laden with the silica dust, so thereby exposing their family or community. So the National Institute for Occupational Safety and Health has begun to look at the workers, but nobody's looking at the residents. Workers have rights. They should exercise them, and I think we're beginning to see that happening. They should do it without retaliation and discrimination. Every year, the Pew organization puts out county health rankings for every county in the United States, and these are the rankings for the counties that are slated to be drilled first. I'll start with my county, Sullivan County in New York. We are 61st out of 62 counties for health outcomes, with the Bronx being number 62. So, but the dark green are the counties that are in the lowest percentiles or lowest rankings. So that includes Chemung County, which is 60th. Broome County is 56th in health rankings. Steuben County is 53rd, and Chenango County is 33rd. Tioga is standing pretty well in health outcomes at 17. So you can see that the southern tier counties are not doing well already as far as their, I can't tell you right now, so because I can't see with my, I'll tell you later when I can look it up, all right? So exposing to the vulnerable populations to environmental and community impacts has the potential to put them under further stress. As I mentioned before, if you're already under stress from being poor or unhealthy, this is going to impact you worse. So the other part of this is of the determinants of health. Besides the social and community impacts, environmental impacts are very, very significant. And so we'll start with air pollution, calling your attention to 2 recent peer-reviewed articles. So the science is beginning to call attention to some of the pollutants. It's taken a while for the scientists to come up with some of this information, but they have. And so we have some peer-reviewed papers now from University of Colorado School of Public Health, and also from Theo Colburn's the endocrine disruption exchange. And what they're finding is, air pollutants do exist. They're at increased concentrations around well pads, and they can cause the accumulation of them. For example, benzene is a carcinogen, and so there's a good possibility that cancer-causing agents are, we know that they are in higher concentration. We can't measure the rate of cancer as yet because, as you know, cancer takes at least 20 years in many cases to develop. And so we won't have those statistics for 20 years, but we have to take some precautionary measures. These are some of the sources of air pollutants. The National Oceanographic and Atmospheric Agency that I showed you the slide before puts out data that shows, has shown that the air of Wyoming and Utah, the Uinta Basin, is worse for ozone with a reversal. So in the wintertime, they're seeing extremely high ozone concentrations. And they're seeing higher concentrations of ozone than they have seen in Los Angeles during the extreme air pollution. Children are especially vulnerable because their lungs continue to mature, and if they mature in the presence of ozone, they become brittle like that of an elderly adult. They're also associated, air pollution also is associated with neurodevelopmental delay, lower IQ in babies born to mothers who are exposed to polycyclic aromatic hydrocarbons during pregnancy, and also learning disorders in exposed children. And the World Health Organization has classified diesel exhaust as a definite carcinogen. There are also, besides just the drilling rigs, there are also the pipelines that emit, that leak. We've seen pictures of the methane leaks, a company by the name of Gas Safety, and another research group, I believe from Boston University, has shown graphs of what the spikes of methane leaks in large cities looks like, and it's very, very dramatic, contributing to ozone as well. Yesterday, Vera and Craig took us around to see some of the stations, compressor stations, and drilling areas in Susquehanna County. And we saw the structures, but we didn't see this material coming out because this can only be detected using a special infrared camera called a FLIR camera. Water contamination is something that has occurred. There are documented cases of it. We know that methane has leaked, and there are two studies showing the mechanism from Duke University and Caltech as well, Cal State. They have also water contamination has also been demonstrated by Drs. Bamberger and Oswald in their recent paper. What they found was that their objective was to do study that showed that animals were the sentinels of disease, especially of the water contamination and chemical exposure. And so a few of the examples were the death of 17 cows that had been exposed to hydraulic fracturing fluid that died. There were 2 cases of controlled experiments, meaning one herd of cows was in a field that didn't have any contamination. In the other field, they drank water that had been contaminated. Many more stillbirths, spontaneous abortions, and deaths in the cows that gave birth. Congenital malformations in the ones that gave birth, but otherwise deaths and illness in the ones that drank the contaminated fluid. And They have a number of other examples, including pets that had drunk from along the side of roads that where wastewater had been spread as a dust preventer. So there's the association that's made, but the exact pathway of exposure hasn't been determined, and that's what needs to be done. That's the next big step for the science community, is to show the pathways of exposure, and the government really could help with that. This shows some of the possible mechanisms, which include poor casing, and as we know, casing failures occur in 6 to 9% of all gas wells drilled and cased immediately. There's a 50% failure rate in 15 years, and in 50 years, they all fail. They're man-made materials, and they're sometimes flawed to begin with, but because they're man-made, they will always fail in time. There are also possible routes of contamination through extended fractures. New York State is riddled with faults and fractures. And so a fracture can extend into an existing, a fracture made by the hydraulic fracturing can extend into a fracture that's already existing. And then also there are abandoned wells. You have a large number of vertical wells that have been drilled and abandoned, and many of them are not even, you don't even know where they are. And so those are conduits for contamination as well. The chemical mix is what is really received quite a bit of attention, partly because Dr. Theo Colburn has called attention to the chemicals. So what we see here is the staging area. We saw something close to that yesterday when Vera and Craig took us around. So the frac chemicals are apparently stored in those containers that are circled. But on the right-hand side there is one cow of the 17 cows that died from drinking that hydraulic fracturing fluid. And what they found in there were petroleum hydrocarbons and quaternary ammonium compounds plus other toxins. So they've been able to figure out that there was an association between hydraulic fracturing fluid and these sentinels of toxicity, for the toxicity. So the reason we don't know more about them, why Dr. Theo Colburn had to search around on material safety data sheets and go around and look at spills and actually investigate material that was spilled, is because these chemicals are called proprietary. There was a nurse that was exposed to hydraulic fracturing or some fluid from a spill at a well site. The driller came in, he was fine, but they had taken off his clothes and she was taking his vital signs and treating him, but she had a reaction, a more severe reaction than he obviously did. And within 2 days, she was in the intensive care unit of her hospital with multiple organ failure, and she almost died. So people will have different reactions, and you never know when who that person is going to be. It could be a strapping, healthy man, or it could be a child. Just your constitution does not predict how you're going to react to a particular chemical. So these are just some of the chemicals that are used. All of them are really toxic: carcinogens, neurotoxins, endocrine disruptors. Endocrine disruptors, by the way, function at parts per million, parts per billion, even parts per trillion. Sometimes the smaller the dose, the more effect the endocrine disruptors have. One such chemical is 2-butoxyethanol that is used throughout the whole life cycle of the well. And Dr. Theo Colburn has described all of the stages during which 2-butoxyethanol is used. And it's extremely toxic. It's for foaming, it's used for foaming, it's used for drilling, it's used for, used as Corexit in the Gulf as the dispersant. And what we know is that it's a carcinogen, It's also, it also causes blood dyscrasias, which means it breaks up your red blood cells, and it can cause bleeding in your various organs. That's all some of the people who were exposed to it had, but the cancer part of it is not going to come out for a good many years hence. And this was, I've spoken a little bit about Dr. Theo Colburn. She's been a great hero on the chemical front. And most recently, she and her group have written this paper on the air, on the chemicals in the air. The main part about this particular paper that I took away is that these chemicals have multiple symptoms. So one chemical can cause rashes and also have some neurotoxic effects and also have effects on your cardiovascular system. So it's kind of across the board. So when you're seeing somebody with a range of complaints, it's hard to say it's from a particular chemical because they're rather nondescript at times. You know, headaches, a little bit of dizziness, just not feeling well. It's hard to pinpoint it on one chemical. So you really do need to have the data that says what kind of chemical it is. It's great to also have that pathway of exposure. Waste is another problem. The best way at this point, according to industry, is to, since they, it's a little bit more difficult, let's say, for them to get it into the wastewater treatment plants. They lose it. It's easy for them to lose it. I think Mac would describe to you how easy it is and how he's heard about it being lost, whether in a stream or whether on the road or at a gas station, not a gas station, but at a rest stop. Somebody would go in for lunch and turn the spigot and lose that water. It would end up in the stream. So there's really currently no safe way to dispose of it, but there are injection wells that are readily used, and the problem with those is that they cause earthquakes, among other things. Plus, we also don't know which way, how the contaminants are going to move, because they often go into wells that have been previously used to extract gas from other formations, and so there could be pathways of established for contamination because they were drilled into faults and fractures. So the geology really needs to be understood, and that's really not the case. We need to have a much better awareness of what the geology is in New York State. We've known that the Marcellus Shale, which is what we have underneath here, you also have Utica, but the Marcellus is highly radioactive, more radioactive than any other shale. And we have measurements in the tens to hundreds of thousands of picocuries per liter for some of the radium that's coming at the wellhead of Marcellus shales. There are recommendations from the International Atomic Energy Agency on how workers are to conduct themselves around potentially radioactive. First of all, they should be wearing dosimeters. They should be wearing respirators. They should be wearing protective suits. I've seen slides of what the workers look like in Norway, and they look completely different from the workers that we saw yesterday. So even though we belong, as the United States, we belong to the IAEA, we don't really conform to their recommendations for workers. On the other hand, we've given them we've given the industry exemptions from anything that comes from downhole. Nothing that comes from downhole has to be regulated. And vertical wells, if they're drilled into Marcellus formations, can produce radioactive waste as well. This, I'd like to call your attention to our area. Where the red indicates radon concentrations. Average radon being in the red areas of 4 picocuries per liter, which is actionable. Actually, 0 radon is safe. But if if you have a radon of 4, you definitely have to take some action in your home, reduce the radon concentration by venting it, getting rid of the radon from your home. Radon is the leading cause of lung cancer in non-smokers, and the second leading cause of lung cancer in non-smokers. So it's a very big problem. 21,000 deaths a year are from radon exposure. So radon enters your body through inhalation. It's exhaled, most of it, prior to doing any harm, but it becomes polonium and lead. That's the decay product. And those are the elements that stay within the lungs, and those are the elements that cause the cancer. So radon needs to be monitored. The other problem with the radon is, since the Marcellus gas is so radioactive, if you bring in Marcellus gas for you to use in your stoves, it's going to increase the radon that's already present in the basements of your homes. I hope all of you have had the radon in your homes tested as a baseline, because it's an important public health issue, even without the Marcellus shale, just simply because you live in a high radon area. And there is mitigation for it, so you can take care of it if you do have high radon. Just want to give you, accidents and explosions also affects your view shed and your food shed, and 1,000 trees per acre usually cut down from a forested area. That's a lot of trees. This is Wyoming, just to show you the development over the course of a few years. And we're concerned, medical doctors are concerned, because the information, the public health information, is still scant. The peer-reviewed research is coming, but there's not enough of it yet. We need to have, people coming forward. Yesterday, one of the things that I wanted to bring forward is a survey, and I'll speak very briefly about it in just a moment, and I know I'm running short on time. But one of the big reasons that we are limited in the information is because we have exemptions from public health laws. So especially key parts of the most important public health laws that were instituted during the Nixon administration, really, to protect the environment and public health. So over the course of the subsequent years, oil and gas industry have received enough exemptions that the federal government is really not tracking the health impacts, which is really of great concern. The New York medical organizations have come to the conclusion that this is not safe as it's currently done in other states, and they don't want it to be done here because it appears to be unsafe, and until it can be proven safe, we don't want it here. And these are some of the organizations that have spoken up for a moratorium. It includes the Medical Society of the State of New York, that just this month came out with a resolution asking for asking again for a moratorium. First time they did that was in 2010, so asking again for it, and this time also asking for a health impact assessment. American Academy of Pediatrics of New York State was at the forefront from the very beginning, supporting the first moratorium from 3 years ago. Mount Sinai Children's Environmental Health Center. Now this is what the development looks like in Pennsylvania and Colorado. It doesn't look like this here, and we want to keep it from looking like this here. And yet, in New York, our doctors are speaking out, and in Pennsylvania and Colorado, they just get gagged. So Damascus Citizens for Sustainability has put together a survey, and we'd like to bring this to the people who are impacted so that they can fill this out and send their petitions for a consultation to the Agency for Toxic Substances and Disease Registry. The federal government simply doesn't know what is happening as far as health impacts. People are afraid. We're willing to come and speak to the people to encourage them that this is to their benefit, to make the federal government aware of what's happening. And we don't have fracking in New York because of a law that we have, and you probably are all aware of it. You've probably all written comments on the SGICE. And this is what doctors have said is wrong with it, all those parts in red. Just as an example, they didn't talk about children, they didn't talk about air impacts to different populations, they didn't talk about waste disposal, they didn't give any reason to be concerned about radioactivity, and yet we know all of those are the case. The setbacks are terrible. They're not protective, especially for children. And there is a process that can assist in the decision making. It should be done before any decision is made. It should be done in a transparent, comprehensive, and inclusive way, inclusive of all stakeholders, all the people who could potentially be impacted, and that's called a health impact assessment. And there are great benefits and advantages to doing a health impact assessment over just the health review that the New York State Department of Health is currently doing. And these are just some of them. So we're in a unique situation here in New York. We have the opportunity to make the decision, to inform the decision in a way that's scientific, that's problem-based, that's peer-reviewed, based on peer-reviewed literature, based on science. And we feel that it would be inclusive of the most vulnerable people. We would make sure that there are no exemptions, and we would also be adhering to the precautionary principle. Thank you.
And that's what a passionate, board-certified pediatrician sounds like. And all of the people that you've heard tonight and the subsequent person you're going to hear in a minute are volunteers. They come here without asking a cent. If they were to be employed by someone to come and spend the time that they've spent with us, we wouldn't be able to afford them. We're going to pass a hat around and ask you to contribute as much as you can, not only for the expenses of bringing them in, but for the potential of extending these forums. We're talking about taking them down into Pennsylvania as well. The workers have requested that we formulate a panel to go down into Pennsylvania and to confront the folks that are living in those communities and potentially give them some hope of moving beyond where they are at this point in time. I'd also like to recognize the fact that in the crowd here are several volunteers that likewise have expended their time in putting together the logistics that are required for presenting a program such as this. And could those folks please stand that have been involved in that, and could we give them a round of applause?